Huh?
So for the causes, the possible causes are congenital structural defects in the either muscular or elastic layer of the vessel wall. So the most common that we encounter here in our unit is the AV malformation, or the arteriovenous malformation, wherein the child upon birth has congenital or genetic defects. So that our artery is interconnected with a vein, and can we just imagine the pressure, higher pressure versus the lower pressure. Also heredity, or just because the vessels are really weak. Incomplete involution of embryonic vessels, so that's also part of the genetics. And secondary factors such as hypertension, because of the increased pressure, thereby it weakens the vasculature of the blood vessels. Atherosclerotic changes, so the plaques or the fat deposits may interfere the proper flow of the blood through the blood vessels, thereby nagkakaroon siya ng pagbaballoon because may nakabara, may nakaharang. So ang magiging tendency niyan, yung blood gigilid dito, then magkakos siya ng pagbaballoon. Then hemodynamic disturbances and polycystic disease. The polycystic disease, masyadong madami yung RBC or the blood volume, thus increasing the pressure. Cerebral aneurysm also may be caused by shearing forces during traumatic head injuries. And then there are other rare causes of aneurysm. So the mycotic aneurysm caused by infection of the artery wall. Tumors, pwede din po. The trauma can also cause aneurysms. Drug abuse, especially cocaine, because it weakens and inflames the artery walls. Then let's move on with the signs and symptoms. So there are 4 major signs and symptoms. So number 1 is headache, worst of his life. So ito yung description ng patient natin. Numbness or weakness of one side of the face. So more likely stroke-like symptom, and a dilated pupil, may it be anisoporic din or unequal due to increased intracranial pressure or blurring or change in vision. Then our greatest or greater concern is a brain aneurysm that leaks or ruptures and potentially may lead to a subarachnoid hemorrhage. So bleeding leaks into one of the membranes that covers the brain and the spinal canal, known as our subarachnoid, or the arachnoid yung membrane. Ngayon, pag nag-bleed siya sa ilalim or beneath the arachnoid, it is known as subarachnoid hemorrhage or SAH. Complications of a ruptured cerebral aneurysm, syempre fatal, can lead to death if bleeding is excessive. Then the subarachnoid hemorrhage can further progress into or may lead to cerebral vasospasm, wherein marami siyang negative effects in our body. Then cerebral infarct and death. The bleeding, according to studies, occurs most often in the first 48 hours after the initial bleed, but still can recur within the first 6 months. And other complications, we have hydrocephalus, or the ang term ng mga neurologists ay herniation from the other ventricle to the other ventricle, for we have 2 ventricles in the brain, and meningeal irritation. So let's see if lahat ng symptoms na ito meron sa ating pasyente or our complications. So this is an example of a brain aneurysm. These are the common types, the saccular, so ganito yung tsura niya, mukha siyang sac, and then the fusiform, so ganito siya, and the ruptured aneurysm. So this is the location of the circle of Willis. Thus, ito yung mga aneurysm natin. So this one is a fusiform aneurysm because kung saan sila nag-meet, dun yung mga weaker spots. So this is a bottom view of brain and major arteries of the brain. We have 4 ways to determine or to diagnose. So the most common and the initial is the CT scan. So usually we try to do plain cranial CT scan or delayed contrast CT of the brain after ng first initial na CT scan. And then lumbar puncture or spinal tap, if we find out that the result has blood, then that's indicative of bleed or hemorrhage. Then your CT angiogram or the cerebral angiogram and the MRI. So this is an example of yung plate or film natin na mayroong bleed. So subarachnoid hemorrhage siya. And then this one is also subarachnoid hemorrhage. And this is aneurysm. Ito yung example ng plate ng mga CT angio. So in our institution, we are lucky to have this one, CT angiogram. And coiling. So dito siya, makikita natin. So this is one of the treatments by the neurosurgery or by the neurosurgeon. So let's discuss the treatment. First is clipping. A neurosurgeon can operate on the brain by cutting open the skull. So mag-craniotomy muna siya, magkaroon siya ng opening sa cranium and identifying the damage to blood vessel. And then the neurosurgeon will put clip across the aneurysm. So pag kinlip niya, this will prevent the blood from entering the aneurysm and causing further blood leakage or further bleeding. So mag-prevent siya ng bleeding. The second type is coiling, wherein the neurosurgeon or interventional radiologist can do this as well because magpapasok lang siya ng tube through the arteries via an angiogram so you can still see. Diba? Parang namomonitor mo siya radiographically to identify the aneurysm, the exact location, and then fill it with coils of platinum wire or latex. So thus preventing the further leakage and resolving the problem. So with my experience, I had a patient din na nagpunta ng UST to do, I'm sorry for dropping the hospital, pero ano naman, successful naman yung operation. So the neurosurgeon namin dito ay also affiliated with UST, and then he decided to advise the patient to go to UST, do clipping and coiling because the patient had three aneurysms. So, meron na siyang one ruptured and then the two are, hindi pa siya nag-rupture. So, para ma-prevent yung further damage, yung ginawa yung clipping and then coiling, which costed the patient almost 5 million pesos. Pati dito sa ICU. But luckily, or when we say it na pag syempre meron kang resources, the patient survived. And now is after from super state siya ngayon, parang doing ADLs na siya. Both these options have their risk, but still, that's one side. And we have the other side, wherein the risk of damaging the blood vessel and causing more bleeding, so is possible. So damaging nearby brain tissue and causing the surrounding blood vessels to go into spasm, which is yung pinaka-iniwasan ng neurosurgeons natin. That's why they're giving medication as well. And thus, this will deprive the brain tissue of blood supply, then causing CPA infarcts or stroke. And then, so after knowing the complications and treatments, so what are our nursing interventions? So we have to plan for our nursing care. Primary nursing diagnosis natin ay alteration in tissue perfusion, cerebral, related or secondary to interruption in cerebral blood flow or increased intracranial pressure. The nursing care plan, intervention, and treatment. So our first priority is always the airway, breathing, and circulation. So for patients na hindi naman nag-breathe spontaneously or normally, so nagiging comatose or in coma state and in stupor state, so we assist them with intubation and then mechanical ventilation and oxygenation as prescribed. Then we have to monitor for neurological status carefully every hour or mas madalas kung indicated by the physician, and we must immediately notify the physician. So, most common sa amin, pag nag-decrease yung GCS, notify the physician. Pag nag-anisocoria siya, nag hindi pantay yung pupils niya, the other one is dilated, the other one is constricted, notify agad yung physician. So, those are the most common symptoms that we, or signs and symptoms that we refer to the physician. Then, prepare the patient for emergency craniotomy if indicated, and if surgery can't be performed immediately, so we may institute aneurysm precaution. So what are these? So we try to avoid doing interventions that may cause increased ICP or risk for bleeding. We also have to administer hydralazine or other antihypertensive agent to control the blood pressure, because the higher the blood pressure, or if the blood pressure is high, it may cause bleeding, and as well kapag masyadong mababa. Then turn the patient often to prevent decubitus ulcers or pneumonia, and encourage deep breathing and leg movement if hindi naman contraindicated. Then we have to apply elastic stockings to prevent DVTs or compression, ang tawag sa amin anti-embolic stockings to prevent or to reduce the risk of DVT.